Hey guys, welcome to another Health Freedom.
Oh,
Are you sure?
Is setting up your meeting.
It says it sets it up, but this is where I stared at the camera for like forever the last time.
We'll get this
Hey
someday.
guys, it's Joni and Erica with Health Freedom Iowa. We are so glad to be here with you again this evening. Tonight we are going to learn so much from Dr. Ravi from Do No Farm Naturopathy in Ohio. He's also a health freedom advocate. I'm going to read his bio really quickly, but we are going to learn how to navigate science, scientific data, scientific studies, and scientific research that's going to help us empower ourselves to take charge of our health and healing all from home. So Dr. Ravi, before I get you on here, ask a million questions, I'm going to read your bio really quickly. Dr. Ravi, okay, I'm going to say it. Kulasekare?
Close.
Okay, hold on. Kulasekare.
Good.
Yes? Is that right?
That's very, very close. I don't
Will
think
you
you're
say
getting
it
any
for
close.
me?
It's Kulasekare.
Kulasekare. Okay.
Yeah.
All right. He is a graduate of Trinity School of Natural Health's Doctor of Naturopathy program and a board-certified holistic healthcare practitioner or health practitioner. Prior to that, as a board-certified medical physicist, his career spanned almost 13 years in the field of cancer care. In 2016, he voluntarily left his position as chief medical physicist at the Metro Health Medical Center in Cleveland, Ohio, and opened his own holistic health practice, Do No Farm, that's a PHARM, naturopathy, in Lakewood, Ohio. Here he works with clients from around the world, teaching and guiding them to adopt the principles of traditional naturopathy with the goal of improving and achieving overall health and wellness. Since 2011, Dr. Ravi has diligently studied the science behind vaccines and vaccine safety. He is a vocal supporter of informed consent and medical choice, both on and offline, and has provided both written and live testimony when state-sponsored bills aimed at removing or restricting vaccine choice are introduced in Ohio. He is also an active advocate of medical and health freedom, both at the state and local levels, educating legislators through in-person meetings and also conducting public discussion forums around the Cleveland, Ohio area. Dr. Ravi, welcome to Health Freedom Iowa and our discussion this evening.
Thank you very much for having me. It's a pleasure to be here.
Thank you. I first met you in 2018, and I was so impressed with the panel discussion that you were on, talking not only about vaccine safety, but health and medical freedoms. One of the burning questions that I think on the natural health side, when we get doctors who cross over, you have crossed over now from allopathic to naturopathic medicine. What is a little bit of your story? What made that decision quite crystal clear for you to do so?
Okay, so first of all, let me make sure that people understand that I'm not a medical doctor. I'm a medical physicist. So that I assisted and worked with radiation oncologists in the radiation therapy area. So I was a certified radiation expert, plus everything to do with the state regulations, machines, and all that stuff, and treatment planning, special procedures, etc. So it's a little bit different than a medical doctor, but I'm was in the same category as a medical professional and physician. So what actually made me leave was the mandatory flu vaccine, believe it or not. So in 2012, if you had asked me to be on the show in 2011, I would have probably asked you what you were smoking for breakfast, because I was, no, seriously, I mean, everybody comes into this with this story. I mean, I had no idea that vaccines were harmful. I had a daughter that was fully vaccinated back in the 90s, which, thankfully was not the same schedule that we see now. Yeah. But even then, I mean, I believed in the system. I believed in what I was told. I trusted doctors. I used to work with them. I had no reason to believe that they were uneducated on this topic. And, granted, I was too busy with other things. I didn't think I needed to get educated as well. And I had never met any of you guys. So, it was quite blissful to be ignorant. And then in 2011, the hospital that I was the chief medical physicist was, I was at the chief physicist there at the county medical center. They sent out a memo saying that, starting 2012, that we were required to have a flu shot every, November or whatever, the flu season, in order to keep our jobs. And so I had been a scientist, since I have a PhD. So I, since 1996, I was used to science, critical thinking, and questioning, even though I had never thought critically about vaccines. But when this came out, that started, I had a question. I'm like, why would I need to medicate myself to keep my job? I mean, that was the question I asked. And nobody could give me the answer. So then I searched the Medicare rule that came out in 2012, in which, 16,000 pages, I found that they had actually put the hospitals on notice to report flu vaccine rates for employees or get a 2% reduction in their reimbursement. And that is what got me going.
So what does money have to do? I mean, it's an obvious question, but what does money and vaccine rates have to do with the hospitals, being incentivized for their
Yes,
employees? Like, what sense does that make?
it didn't make any sense at all.
Right.
So I marched right into the chief medical officer's office and I said, I am not taking this vaccine because I know why you are doing it. And he wasn't confrontational, but he said that, we have to keep our patients safe. And I said, well, for one, we do not keep track of anybody who comes into this hospital. Even if they do come in with flu-like symptoms, we don't track it so that patients can come and go and patients can go outside and we have no idea who and where they get exposed to whatever. So there was no data to back up. And I'm a data person. I need to see the data in front of me. There was no data to show that vaccinating an employee would reduce anything for a patient or an employee for that matter. And I used to see people who got flu shots even without the mandate. 2 weeks after they got the flu shot, they were sick like dogs. And we were working in cancer care. So I understand the patient perspective because cancer patients are immunocompromised to start with. And therefore, if you're hacking around, coughing and being sick around them, that could put them in some danger. But then I saw the people who got vaccinated were the ones who were getting sick. And I had never got the flu, nor the flu vaccine for, the 20 some years that I've been in this country. Back where I come from, we don't even have the flu because, I'm 7 degrees north of the equator. I mean, we don't see or hear flu seasons, so to speak, right? I mean, it's there on and off. So, it, so I was pretty much the only person who refused that flu vaccine in that entire department. So, and I had one thing going for me, and that was that they couldn't get rid of me. Because it was hard to find someone to replace me within 30 days, which the state required you to have a board certified physicist on site. So because of that, they gave me an exemption because they used the excuse that I was vegan or whatever, and I said fine, but I said you need to make that exception for other people who needed that and who qualified for it, because they said that there would be religious and philosophical exemptions, but that's not what they did. So I know a couple of my friends who got fired, and they refused. They were let go. So that was the start of me actually getting. And then of course there were other things. As the thing with medicine, Joni, is when you go up the ladder and when you start doing budgets and when you start doing the financial aspect of it, you kind of get disillusioned a little bit because it's not so much at that point about the patient. It's about the bottom line. And I wasn't feeling all that great about what we were doing. I mean, we were doing good patient care, but at the same time, what we were doing was centralized around the finances. And that's what they were after all the time. And I got sick of my bosses coming in my office and asking me why we're not meeting the numbers. I mean, to me, that wasn't the goal of me being there. Me being there was everybody who comes in there gets the best treatment they can. Granted, they would have probably had a much better outcome, as far as quality of life goes if they hadn't been there. But that's, what we did at the time. So then, of course, I ran into someone who, I forget where I ran into her, but it was at a chiropractor's office, I believe, who told me that she was a graduate of Trinity. And I looked into it and I said, well, I think this was what I was waiting for all my life. So, for the third time in my life, I changed my career and went back to school. And I actually was there for 2.5 years before I think I completed 5 years in my position. And that was the contract. And I just 5 years and 3 days later, I gave my notice and I walked out of there. Never
Wow.
looked back. Yep.
Wow, I was going to ask you like if there were threats of being fired at all, and a couple of things caught my ear when you were talking about them giving you an exemption because you were vegan, and now I'm like, can they expand that to every person, please? Because
Correct. And
there's
this is
animal
what,
products in the vaccine that we're
yes,
injecting, right?
yes. And I'll be honest with you, at the time in 2012, my knowledge about vaccines was not where it is today. And I can tell you, I became the most ferocious student of vaccine, history, knowledge, and what's in it. I had no idea what was in a vaccine. I mean, I knew what was in the flu vaccine. I knew there was eggs in there. But other than that, I had no idea what was in. I mean, then I started looking because the more I started speaking out, the more pushback I got. And yes, you're right. I was threatened of being let go, and they harassed me for like 2.5 years because I refused to wear a mask too, because that doesn't make any sense to me. And I told them point blank, I mean, you have people who have had the vaccine who are running around in this department in front of patients, coughing and sick, and you are asking me as a healthy person to mask myself for no reason at all. And I said, I refuse to do that. So, there was confrontation a little bit there, and, they didn't like that, obviously, because nobody likes people who question anything anymore. They all want, people who say yes and do whatever. If you say jump, ask how high, and I wasn't one of them. So I knew there was a time when I would have to walk away, and it turned out that it worked out just fine. I mean, it was time for me to go. In 6 months after I left, I was able to finish my ND program at Trinity and then start my own practice, which has been quite a blessing, actually. I'm at home now with my 4-year-old, and working from my home as well as from my office, and touching people's lives around the world. It's been great.
Thank you. Thank you for doing that and for making that choice and
No,
for having a
welcome.
conscience. So let's get into some of the critical thinking aspects when it comes to scientific data, scientific studies, and scientific research. As a layperson, what, and I don't want to highlight the mistakes, but what do you think the biggest mistakes that we as lay people make when looking at scientific studies and scientific research? Because you really get grilled when you start getting into Facebook exchanges, and information or misinformation starts getting shared. It can kind of get spread around very quickly, and it's not until someone who understands the science comes in and says, wait a minute, guys, this is the context in which it's being studied, or in which it's being used. So what are some of the things that we do that we can avoid and learn from?
That's a great question. I mean, and this is not to discredit anybody at all. I mean, we all learn, and I think the perception outside of the mainstream, I mean, like the mainstream or the lay people, is that you have to be a scientist from that field in order to understand the science. And I think that's true to some extent, but not the whole way through. I mean, like so I have published papers, I've done peer review. I mean, I've been in before my time, even before the medical, like the medical physics, I used to be in industry. I used to work for Goodyear for many years, and we used to do a lot of science and publication and stuff like that. And even before that, doing my PhD. So yes and no. I mean, like, once you learn or train yourself to think critically and once you know what to look at, then you can carefully take your time and analyze scientific research and understand what's going on. I mean, you just need to have a basic understanding of science and what they're talking about. So terminology is important. I see a lot of people posting, on Facebook stuff, and they're talking about a paper, but they're using the wrong terminology. I mean, that's a good way to get attacked, because then the people who know the science are going to say, like, you don't even know what it's called. So take a little bit of time and understand the terminology and what it means, and that's important. That stuff is easily found online. It's not hidden from view or anything like that. The other thing, I think the most important thing is, like, we shouldn't, so there's science and then there's articles. There's a distinction there. Okay.
Okay, can you get into that?
Yes. So when people say I've done my research, and then they they show or they post an article from like a website, like, and there are some trigger websites out there, no matter what they post, if it's good or bad stuff. And I'll give you one example, and there's nothing against this guy at all. My Natural News has bad name outside, right? I mean, it's if you look around Wikipedia or whatever, the mainstream considers that as bad news, bad science, whatever. And sometimes some of the stuff they put is good, but it doesn't matter. So that's an article. So if you read an article, you get some information from it, but then you need to go back to the sources. The science is always in a peer-reviewed publication. So if you're doing research, you're reading peer-reviewed publications. You're reading articles, you're getting the background on it. And if the articles don't cite peer-reviewed articles, then be careful when you republicize it, because you're going to get attacked. Okay, so, and this is again, I'm telling people how to avoid the unpleasantness. I mean, it doesn't matter. Like, I republish things from articles all the time. But if you deem that it's valid and it's good, there's no reason not to publish it. But if there's anything, because you have to understand, I mean, everybody has an agenda, right? And it doesn't mean that only the pharmaceutical industry publishes things with an agenda. Sometimes we may too. And so you have to draw that fine line. You have to make sure that the person who's writing the article is not writing it with some sort of bias in there. But then if you look at the sources and then you determine that the sources are true and that's matching with what he or she is saying, then that's fine. But that's, I think, another distinction people need to realize, so that, like when you read articles only from websites, questionable or not, that doesn't account on the outside as doing your research. And I've seen this happen a lot of times. And people will say, oh, I do my research, and then, like they'll post a lot of things that come from like, YouTube or websites, and then they get attacked because they'll say like, well, that's not research. And there's some truth to that. Does that make any sense?
Absolutely, absolutely. Yeah. So it's like, not only do you have to look at the sources they cited, but go to the sources that they cited and see if the research, I mean, as just from the research that I've done, this is how I've learned to fact check for myself, is to go to the sources that are cited, look at not only their sources, but make sure that whatever article you were reading is quoting that source or that study in context.
Yes.
And then go and, I mean, you can go as far as researching the different doctors or scientists who published it, looking back further to see if any pharmaceutical ties are in those studies as well. So it does take a little bit of extra digging, but when you walk away knowing that you have followed that rabbit trail or that rabbit hole all the way down to the very lowest point or end point that you walk away with a sense of like, that's where health freedom comes from. We're free to research these things and disseminate the information and make up our own sovereign decision on what we want to do next with our health.
Absolutely.
Do you have anything to add to that? Because I do have a quick question about peer review. Can you explain what that process is? So when people hear, we hear keywords like peer review, or we hear, double-blind study, or we hear placebo, and we, those are some keywords to understand when you're looking into science studies. Yeah, let's talk about peer review for a minute, because this wasn't always the standard in science.
No, because I mean, so obviously, I mean, at some point there were not enough peers to do the review, right?
Right.
So, obviously the peer review process was, not there. But once they had enough people, and so the way it works is like once you are in the, I mean, I have like gotten out of the peer review process now for a while now, since I haven't published. But when you're publishing regularly, you get into this pool of peer reviewers. So what happens is like each journal has an editor, or a bunch of editors and a chief editor. So what they do is, once they get a paper, so you submit the paper to the editorial staff, and they will pick, supposedly randomly, a couple of people, 3 to 5 people from your peer review group. So like, say I'm publishing something on vaccines. So then they'll pick 5 people who were previously published on vaccines or considered experts on vaccines, and they'll send the paper to them for their input. And so what they will do is they will go through the paper, the draft form, and we usually read through everything that they've done. We check the references. So it's a bit of a, bit of work for the people too. And we make our comments, and then we tell the editor. So we actually check for scientific accuracy. Obviously, grammatical stuff, scientific accuracy, if the paper is doing what it's supposed to be doing, and if it's new research or not. All this kind of stuff is done during the peer review process, and then we'll see if it's even worthwhile publishing, because a lot of people just publish junk, right? And if something has been done the same thing has been done before and there's nothing new in this publication, to stuff like that. And then we make a recommendation to the editors to publish with changes, to publish as is or not publish. So those three options, those three things are determined by the peer reviewers. And then when all of them come back, if say 2 out of 3 peer reviewers said publish as is and the one guy says don't, so then the editor goes back to that guy and asks them, like, to reconsider or see why, uh, you know, I am so adamant against it, and sees if there's any value in what might say. Because sometimes some people, the two that said fine, may not have done as thorough of a job as I do. I mean, I used to be very thorough in my peer review. So, because it was important for me it was a responsibility pretty much. So then, like if he reads again and he's still adamant and he gives the editor, a little bit more information, then it can go again back to a different set of peer reviewers. So it takes a couple of months for this process to go back and forth until, the majority decide to publish or not publish, and then the paper gets either published or not. And I'll tell you a really interesting story here, which, back in 1996, when I finished my PhD, I had done my research on something that someone who was a well-known person in my field of polymer physics had actually done before. And I was contradicting what he was saying, and there was clear data that what he said initially was not correct. So I tried to get my paper published. I mean, this was my first paper, and this is why I didn't go into academia, because I realized that it was a big brother's club. Nobody accepted the peer review. You could actually deny the peer review, saying there's a conflict of interest. That's privilege of the peer review. So me and my supervisor, we tried for 4 months to find someone to peer review it, and we couldn't find it. So we had to actually go to a lesser journal, because there's different classes of journals too. And then, they agreed to publish it. So peer review process is not 100% foolproof, believe it or not. It's a big brother's club, or big sisters club, or whatever. I mean, there's female, but you can influence the process. I mean, if you're known in the field, or you have certain privileges, or push somewhere, your papers get published no matter what garbage you put out. So, and knowing this, I don't put a lot of faith in the peer review process. And I'm sure you have heard, I mean, I don't know if you heard Dr. Richard Horton's comment. I mean, this is the chief editor of the Lancet, which is the most prestigious medical journal. And he's the chief editor there for 25 years. He's been with the journal for 30 years. Have you ever heard his comment in the 2015 opinion piece that he wrote?
I am sure that I have, because it's circulated around. It's just not at the top. It's not at the forefront of my mind. As soon as you say it.
Okay, because I mean, I think I have it right up here. I mean, I can go through it real quick if you want. I mean,
sure, absolutely.
Yeah, this is directly from the Lancet of April 11th, 2015. It's on page 1380. It says the case against science is straightforward. Much of the scientific literature, perhaps half, may simply be untrue, afflicted by studies with small sample sizes, tiny effects, invalid exploratory analysis, and flagrant conflicts of interest, together with an obsession of pursuing fashionable trends of dubious importance. Science has taken a turn towards darkness. So you can, and this
Amazing.
is coming from the chief editor of the Lancet. So
This is why people say, a lot of people, at least in our communities, that, to believe in science as is, as checkbook science, we
yeah,
would call it, it takes an act of faith. And so science as is today, not pure unadulterated science, but the science industry today has been so adulterated, it's like a religion. You have to believe in it and have more faith in it as its own religion because of the medical mistakes and just the quote of Richard Horton.
yeah, and then I mean it's not only Richard Horton. I mean there was Dr. Marsha Angel, who was the chief editor of the New England Journal of Medicine, who said that it's simply no longer possible to believe much of the clinical research that is published, or to rely on the judgment of trusted physicians or authoritative medical guidelines. I take no pleasure in this conclusion, which I reached slowly and reluctantly over my 2 decades as the editor of the New England Journal of Medicine. I mean, these are powerful statements that show that the industry actually, and I can tell you for a fact, when I was doing, industrial research, the industry that funds the research also manages the data. They give you the study designs. They literally have the capacity to even write portions of the publication for you. So, I mean, there's ghostwriters in every industry that will write the stuff for you. And if everybody now under pressure to publish or perish, especially in medicine, because I know that at the hospital where I worked at before the last one, I mean, if you didn't publish, I think it was like 2 publications a year, I mean, you would lose your job pretty much. So they'll take money from anyone and do whatever they want and publish it.
Yeah.
So I think you need to have like a whole good dose of common sense too when you're looking at scientific research to know, and that's the hardest part that I have when I read a paper is to decipher if the paper is actually industrially funded and if it's actually doing real science, or if it's doing something that actually is beneficial for the industry versus for the benefit of all mankind. And there are a couple of ways you can find that too. I mean, like there's things you can look for, which we can kind of get into a little bit deeper if you.
Let's get into that. So as lay people, so we've got this peer review. Maybe we'll just go back to that here in just a moment. We have peer review, and then we have the double blind studies, the placebo. What does that mean? Because in order to understand the context of a study, it's probably important to know whether or not it's been peer reviewed, right?
Yes.
The difference between an article and a scientific study.
Mhm.
And we'll get into like where to find some of those studies as well. But double blind, what is that terminology reference?
Okay, so there are 2 types of blinded studies. So there's a single blind and a double blind. The single blind study means that you basically only the patient doesn't know. So I used to do a little bit of clinical trials when I was at the last place I worked. So only the patient doesn't know what they're getting. The doctors know what they're giving the patient, and so that's a single blind. When it's double blind, they both don't know. So you have, so then you have two groups of classes of patients. You have the control group, and then you have the actual treatment group, and then you have a control substance that you're giving and also the actual treatment substance, and no one knows who gets what except the clinical trial organizer, whoever that organizes the trial. So there's one person who keeps the data, who by numbers know which is which, but those administering or getting don't know which is which. And then after so then they follow the trial participants for a designated number of months or years or whatever that it takes, and then the data comes back to the data collectors, and then they will do the analysis, and let the principal investigators know how many of the actual people who got actual drug had the effects versus the placebo. Uh, Does that make sense?
Yes, yes. And that's some really important information there that, we want to have understood when you go into researching this. Now, when we do get the results of these double blind or single blind tests, sometimes, as I have found in studying like medical history and the pharmaceutical industry, they're not honest with those results. So, for instance, when I first started learning about this, it was a documentary called Made to Kill, and it was from CCHR, Citizens Commission on Human Rights. And they made this, they made several series of movies that highlighted and exposed the pharmaceutical industry. For instance, I'll share the story with Cymbalta. For instance, Cymbalta is a popular antidepressant that they prescribed, and there were known deaths and suicides that were committed because it makes people suicidal. It makes some people suicidal, and they didn't disclose that to the general public, that was the case of their study. How is it that pharmaceutical companies, through the studies that they do, or in scientific studies, are able to skew the data to make it say almost anything that they want it to say, where it's positive enough to pass then through the FDA or any other regulating agency that would then say it's safe through like the CDC? How does that happen?
In one word, money. I'm sure you knew that, right?
I did. And,
So,
and yet, you go through the whole thing and you're like, how does it make it from here to here to here to here with this many people looking at the results, the poor results or the unfavorable results or death? And then how are they legally able to promote it to the public that this is a good and safe thing?
this is called statistical manipulation of data. And this is one of the most commonly practiced, it's not, okay, so yes, it is some fraud involved in it, but then you have to fall back into what is known as a study design. So pharmaceutical companies are very good. So back in the, okay, let me backtrack a little bit. So 30 years ago, when I first, did science, okay, we had a process by which we had a hypothesis, and then we collected data, and we did the experiment, and then we verified to see if our hypothesis was valid. And if our hypothesis was not valid, we published the data saying that our hypothesis was not valid. That was valid science.
Right.
Right.
It was honest.
So it was not, yeah. This is how science used to be. You make up. So you come up with this idea, and then you collect the data based on a scientific method. You draw up. You design the experiment. You say you collect, this amount of data based on these conditions. You have this intricate way that it's not intricate, but it's like detailed methodology, right? And then you collect the data, and then you analyze the data, and then you come up with a conclusion. And then you see if the conclusion matched what you thought initially. What happens today is completely different, okay? What happens today is you already have a conclusion, and then you design your experiment, you collect your data, and you analyze it, and you statistically manipulate it to get to your conclusion. Okay, so when that happens, it doesn't matter what your data says. It doesn't matter what your control is. It doesn't matter how many people died. You've already created a pathway for that data, for that experiment, for that method to give you your conclusion. So there's a conclusion bias right there. Okay, so that's confirmation bias. You know what you want, you're going to get it no matter what. And if you don't get it, sometimes they throw the science off or they manipulate it. We saw this very clearly in William Thompson's, study, right?
Right.
They didn't get what they wanted, so then they started adding other things. I can tell you, if you're creative enough, which most scientists are, you can find something to exclude the data you don't want or include the data that you want, right? You can say, okay, I'm going to include everybody who has red hair into it because half the participants had red hair, and we want more people in our study. So yeah, you include that criteria. So this is selection bias, right? You can, so therefore you can bend the data, you can manipulate it, and you can outright manufacture data too, which some people do. And then your study is, no one except the very carefully study people who carefully study the method, which is what I was going to say next. I mean, when people are reading science, they need to quit reading the abstract. Okay,
That's
most
an
people,
important key.
yes, most people read the abstract. The abstract is meant just for the editors of the journal to read, and they understand that stuff to see if it's worthwhile publishing. It does, for me, it gives no information except at the very end, after I read the conclusion, I've understood the paper, I know what they're saying. Then when I read the abstract, I understand stuff. Never read abstracts.
How
Okay.
do we get access? Because sometimes abstracts seem to be the only thing that we have access to when I go to PubMed.
Yeah.
I'm like, oh, I see this abstract. And then if I want more, I somehow have to have some credentialed like enrollment or something. And then I'm like, well, I don't have that. So that's as far as I could go. Or I try to find the study somewhere else or see if it's mentioned or published elsewhere.
Isn't that unfortunate?
And it's also kind of like, the concept when to keep the lay people from having the translation, if you're a religious person, they would chain the Bible to the pulpit,
Yeah.
to keep other lay people from being able to read it and translate it and understand it. It seemed, and that just makes science seem even more religious, that only a particular amount of people can have access to that information.
Yeah.
Yeah.
And the unfortunate thing there is it's a double-edged sword. So publication include, I mean, each paper, in an average journal costs like $2,000 to publish. So a lot of people, when they do that, they don't make it like, public access, or, it's not a free document. But it's changing. I mean, they're having more and more people publish their papers in freeware sites where you can download whatever, and it's a shareware site. So you can get some from there. If not, unfortunately, like you said, you need to know somebody in the medical field who has access to the documents if you want to read any of the papers. Now, I have a older child in medical school, so I get the journals to my house because she put the permanent address as in my house. So I get them and I glance at them and use them, throw them in the trash. But if I see something good, I rip the pages up and I keep it because I have that. I used to have access to it, but I don't anymore. I mean, when I used to back when I was working, I download a lot of stuff and I save them. So I have actual papers of a lot of the studies that many people, have access to abstracts to. And again, we can chat offline. I mean, if you have anything that you need, let me know. I'll be more than happy to find them for you.
Thank you. I appreciate that.
No
It's very helpful to know people who do know how to interpret it for you or help you obtain information. One other thing I wanted to ask you, where are some of the places that parents, for instance, can start? Because this can seem really overwhelming in this process of not only kind of relearning how to critically think, but where is a really good place to start and a few key things to remember. So we know that science can be skewed. We know that science can be bought and paid for. Is there anywhere or any way to trust science? And if so, where is it?
So I mean, unfortunately, we have to trust the science to some degree because I mean that is, without that, then you're left to your own devices. And I hate to say, even though half of it is probably junk, at least the other half will provide us with some information, right? So I think we cannot discount the scientific method. I mean, there's good people, there's good papers, there's people who do good science, so we have to rely on that. And none of those people's names begin with Offit. So don't read any of his publications, they're junk. But if I have to tell someone how to actually, without getting frustrated, read a publication. Well, first of all, like I said, I mean, learn the terminology. It's not that hard. I mean, find a site where you can type in a word and see what it means. You need to know how to navigate through a publication. You need to know the terminology. That's important. Don't read the abstract. Read the introduction of the paper first. So if you want to see if a publication is worthwhile, I usually go right to the authors, okay? And you can always see their affiliations, every publication, the authors have to file a conflict of interest report. Okay. So you have to, it's somewhere, it's hidden somewhere in the paper. So you have to like scroll down somewhere. Sometimes it's down, sometimes it's up, but there is a COI that has to be filed with it. Read that, see where the conflicts of interest are, and then look at the authors, see where they're, from, what they do. That will give you an idea of, if they work with the industrial art, uh, or not. And even if they say they don't have a conflict of interest, these days conflicts of interest are hidden in so many things. I mean, I can tell you stories when I used to work that, you probably won't even believe me. I mean, it's illegal, but it happens still. So it's important to know like that stuff first before you invest a lot of time, right? And the next thing you want to know is like identify the question. I mean, see what they're trying to look for, and if that's what you're looking for. Because sometimes some of these papers, the title doesn't really tell you what they're looking for. Uh, and the introduction to the actual paper will tell you what they're looking for. Okay, that's important. And there also you can see, if you read carefully, if the research is based on some agenda or not, or if it's like, a study that's looking at a wide range of, things with a lot of people. Number of study subjects in a publication is important. The smaller the number, the more error the results will have. Okay, so if you have 10 people versus 10,000 people, I would read a paper that has 10,000 subjects in it than 10. Some of these, I mean, I'll be honest, I mean, I have published a paper with one, but sometimes it's important because if it's something new, okay, and you want to tell the world, hey, I found this, now go and then one subject is good enough. Okay, but if it's something that we already know, like say, HPV vaccine adverse events, and you have like 4 people, that study is junk. I mean, you can just pretty much, throw that out the window right away. Take notes. I mean, you're going to have to read that paper several times before you get it. So as you're reading, make notes of things that catch your eye, like, things that they've done, things that you want to know. Make little notes as you go on, and then ask questions from yourself as you go on as well. That's really important because some of the questions that you have may be answered in the paper and maybe not. So ask these and then come back and look at it and see if you answered your question while reading it. uh, and then the most important thing, I think, is to read the methods and see if the methods make sense to you. Okay, how they've done the study. Like, to take your example, for instance, or the one that you referred to, the Gardasil 9 vaccine clinical trial. The method made absolutely zero sense to me, because it all sounded good because they had 3 different groups. It was randomized. Well, it was not. The participants were not randomized. That's a clear red flag to me in any paper, because that means that you're selectively getting participants to enroll. You're giving them a questionnaire and asking them of their health, and you're cherry picking the good ones.
Okay, so if a
Okay.
scientific study has participants that are not randomized,
Yes,
that's a red flag.
that's a red flag for especially vaccine trials, because remember, a vaccine is recommended for everybody. So then if you're doing the clinical trial on selected individuals who are in better health, that trial result is not applicable to the entire population who has MTHFR gene
That was
mutations,
that
who
was the
have
first thing I was
autoimmune
gonna say.
disease, right? I mean,
Yeah,
does that make sense?
yeah, absolutely.
Yes. So, I mean, so in certain cases, it may be okay. Like you're looking for, a new cancer drug or something. Fine. Selectively choose your candidates because you want, to find the effect of the drug, not necessarily to prescribe it to everybody as a prophylactic, right? So again, it has to make sense to you, but read the method, see what they're doing. And that particular HPV trial, I mean, started out really great. So they had like these participants, they had hundreds of people in this trial. They had the vaccine, they had the aluminum adjuvant as a placebo, which I disagree with completely because that's not a placebo. And then they actually had a saline placebo as well. So I said, oh, great. So now we have a saline placebo trial. We can cross-check with everybody. The data actually showed the saline placebo had 50% less adverse events than the rest of them. But when they published it, they combined the two placebos together. Now, that's another trick that a lot of people use to wash out effects, because if you combine certain things, then the effect gets washed out. Okay.
Right. So the harmful side effects
Yes.
from an aluminum adjuvant, which is a neurotoxin, hyperstimulates the immune system. So you have an immediate inflammatory response. Your immune system freaks out to overcompensate to try to make the vaccine take, so to speak. I mean, this is kind of how I've learned to understand this through the years as a layperson. And so the saline would, of course, show fewer side effects. But if they mixed the aluminum adjuvant study and the saline study together.
Yes.
Oh, okay. Do you remember what the aluminum adjuvant reactions were?
It was pretty close to it was a little bit less than the actual vaccine, right? So when they combined the two, the placebo was not statistical. So that's then we come to the other place where they make these, fuzzy conclusions, the statistical significance. So when they combined the two, the statistical significance of the placebo became negligible. Okay, so to be statistically significant, you need to have a certain level of difference between the two. That's what this, whole p-value thing is, which we won't get into. It's way too complicated. Even for me to explain, I don't even know how to explain it to you. But the idea is that to see if the two things are significantly different, to say that there is a difference. Okay, so if you wash out the difference to a point where they're not significantly different, whereas the saline by itself was significantly different, now you have committed some kind of fraud, some type of fraud in order to wash the effect out. But the logic used to get away from it is to say that, well, aluminum adjuvant, is safe, and we have no historical data to show that it's, that anybody has died from it or whatever. So there's technically no side effect, and which is wrong, which we know is wrong, and we know it's not correct. But that's the assumption. So when you make that assumption and you make that kind of fuzzy, thing, and then you get this conclusion that is completely off from what you would have had if you had three separate. And there was no reason to combine the two. If they had reported vaccine, aluminum adjuvant, and saline, there was a clear distinction between the three.
Right.
Okay, and that would have had a very different conclusion from what they arrived at. So again, read the methodology, make sure that it makes sense, make notes, and then you read the results. I mean, sometimes the results, when you read it, you may draw a certain conclusion, and when you read the conclusion, they've drawn a completely different conclusion. So that's where the statistical manipulation comes in, okay? And this is somewhat confusing to a lot of people, and sometimes even I'll go back and go like, huh? They didn't say this at the beginning. And then I go back and see then you have to see what assumptions they made and what criteria they use to make that difference. And you'll see that they use certain criteria that washed everything out. And so that the conclusion in the result the results was not completely what they concluded at the end. And they'll say oh, there was no relationship because they were not statistically significant. So, it's a, and the more you do it, the more time you take to do this, and the more you read it methodically through the paper, the way, read the introduction, read the method, we understand how they plan to do the experiment, what they're going to look for. And then you look at the results and you look at the conclusion and the discussion, go back and forth a couple of times. You start to understand what they're saying, okay? And even with the best of opportunities, you're still sometimes going to get confused. And I'll give you, do we have enough time? I can just run through a real one other.
Please do.
So this one paper, and I'll be more than happy to send this to you, so you can actually share this with anybody who wants to read it. It's a classic paper. I ran across this when I was doing my ND thesis for Trinity. So this paper was actually, let me just scroll through and tell you who wrote it. It was written in So it was in the JAMA, JAMA in 2016, November 22nd. These guys were actually, I think, part of the CDC. Yeah. So because I know Shahab, Nadine Shahab was a guy from the CDC. So he actually did a study on US emergency department visits for outpatient drug adverse events in 2013 and 2014. This paper for some reason caught my eye. So I was like, and the reason so sometimes you find papers, you ask the question and you kind of run through a paper and you say like, oh, maybe this will have the information I want. And I was looking for like, would children who had adverse vaccine events be somewhere recorded in emergency department visits?
Right.
Okay, that was the question I had in mind. So I ran across this paper and I said, oh, great. So somebody actually did a study on US emergency department visits in 2013, 14. Let me see what they found. So when I was reading through the paper, I figured that they were looking at drug side effects. And I said, okay, maybe they didn't have vaccines. But then I went back through the paper, like the order that I was looking for, and I found that they actually did have vaccines in there. And I said, oh wow, so this is great. This is what I'm looking for. So then I looked at the data, and the data said something that didn't make sense. Okay, I looked at the number of people who were in emergency rooms and the percentage that they came up with in the conclusion didn't match, because I did the quick math. Like I said, I mean, I took a calculator and I did the percentage, and I said, that's not the percentage that I got. So then I went through, because initially, again, for time's sake, I skipped the actual data, the tables, and I said, okay, I'm going to now have to look through the tables to see what they did. So when I saw the vaccine reactions, they had 2.2% of people, and this study was for like 46,000 people.
Wow.
It said 2.2% had vaccine adverse reactions, and I said that cannot be, because the conclusion data was different. So then I went all the way down, hidden on table 4. What I found was mind blowing, and they never made a reference to this. And I actually wrote to the guy. I said, why didn't you make this very significant finding? Why didn't you publish it in the paper? There was nowhere in that paper where he mentioned it. So where I found the interesting part was, in one table, they broke down the age by age difference, the vaccine adverse events. Okay.
Okay.
And when I looked at the age difference from age 0 to 5, there had been, so it was 0 to 5 years old, 20% of emergency room visits in that age range was for vaccines. And then 6 to 10, I think it was 6 to 10, it dropped down to 4%. And then, as the age bins progressed to 80 years and older, there was always 1%, 2%, 3%. What they did, they combined the percentages. So the 20% got washed out.
Wow.
But now think about this. What age group do we vaccinate children the most?
0 to 5, 0 to 6.
Exactly.
And not to mention, if doctors aren't properly trained in adverse events reporting, we know that like less than 1%
Yep.
are actually being reported.
Yes.
So
So
the
with the
implications
less,
are huge.
yes. So with less than 1% being reported, 19.5% of the people, the kids who came to the emergency rooms in 2013 and 14 had vaccine adverse events with that low reporting rate. And this data was buried in here.
Yeah.
It's still buried in there. No one knows it's there, except I have the paper.
Right. And it's psychopathic, because it's like they do it in plain sight. They commit fraud and illegal manipulation of data in plain sight. And so it's very difficult for the common person who doesn't maybe know how to calculate those percentages, who doesn't know to look at those tables, which I'm never going to look at a scientific study the same after interviewing you, Dr. Ravi. Yeah, I mean, like, you've just helped give me enough little red flags, or, perk my, research antenna enough to now want to go dig into a study with very different eyes. So thank you
Oh,
for
great,
all this
no problem.
information.
And I'm going to send you this particular emergency room study, so you have that, and you can. I mean, everything I said today, you can actually use in this paper. I mean, the paper was. It wasn't that it was badly written, but this particular data point would have caught my eye, and I would have asked the question: why are 20% of the emergency room, and the conclusion they drew from that was that because 80% of them were for like antibiotics or whatever, that the majority of children 0 to 5 years that come to the emergency room have antibiotic adverse events. But
Well,
the
and even
20%,
with antibiotics, like,
yeah, and yeah,
antibiotics are in the vaccines, and then
mhm,
they give them the antibiotics because they get sick
exactly,
from the
yes,
vaccines.
yes.
Yeah. Wow.
So, yep,
Wow.
this is where we are with science today.
So
It's
what is the solution for this? I mean, it's like we have to, and I know this terminology has been used, and of course I got it from the great James Lyons Weiler, but it's like we have to unbreak science.
mhm.
But at the same time, I've seen things where like the system's broken and it's designed that way.
Yeah.
So how can parents make educated decisions for themselves with confidence? What do you think some of the greatest resources and tools that they can use to make the best decision possible with confidence?
I think for those who are not comfortable or confident yet to jump right in, the best way to do it is, I mean, there's a bunch of people out there, like James Lyons Weiler is one of them, Children's Health Defense, and we do it at a minimal level, but that's what they do all the time. And then there's like physicians for informed consent. I mean, there's doctors groups, there's a bunch of people out there who are doing the work for uh, tag along and check with these people often enough that you try to, once you see the paper and once you see their interpretation of it, then you start to realize what we're looking for. And like there's a bunch of people on Facebook too, and I do it sometimes myself. We'll take a paper and we'll give our opinion on it and then post it on there. So there's like, that's where I think I would start. I mean, like, this way you kind of get the confidence to do it yourself. And also like you have a backup plan where you can fall back on others who are doing this and get, the information from them. That's, I think, the only way to do it, because the system is never going to change, because it's based on the incentivization to do bad science is far, far greater than, the incentivization to do good science. So you're never going to see this. I mean, even after the two chief editors of the two largest medical journals said what they said, nothing has changed. And this was 5 years ago, right?
Right.
So, that's probably the best thing they can, people can do. Just, keep plugging away at it, keep asking questions. I mean, there's a lot of people willing to answer them. And, that's kind of where I would leave it. That's,
Awesome.
yeah.
Thank you so much, Dr. Ravi. I
You're
appreciate
welcome.
you're letting me kind of pick your brain and check your check in with you on your previous experiences, and your transparency has always been one of the things that has impressed me the most, with your willingness to share your journey and where you've been and what led you to these decisions to not be a part of the allopathic systems any longer. And thank you. I really do appreciate that so much. Do know Pharm, PHARM Naturopathy. You can find him on Facebook. You can find him, we'll link his profile here in the comments below, as well as some of the comments that he had. Dr. Ravi, thank you for being on Health Freedom Iowa today.
Thank you for having me. I appreciated that. It was great to relive some of those old memories.
Yeah. Well, it's good to share the story that's going to help empower other people. And if
Absolutely.
you guys have any questions, leave them in the comments or send us a direct message and we'll pass those on to Dr. Ravi if you don't connect with him personally yourself. And don't forget to join us next week as we do another episode of a live Facebook for Health Freedom Iowa, and we'll be posting some previews of our next guest for next week. So we look forward to it. Dr. Ravi, have a wonderful evening. Thank you again so
You
much.
too. Thank you very
Thank you
much. You
so
guys
much.
too. Take care.
All right.
Bye-bye.
Bye-bye.